Everybody, welcome to our webinar today. So this one is a little different, as you well know. We're going to do kind of a question and answer format. So we had some questions that were already submitted, and then we're going to answer them live here. And some of them we had pictures that we can kind of show you, and some of them we don't, but still you'll still get the gist. Our panelists today. So first of all, we have Dr. James Beckman. He's the founder and CEO of TheraDerm. He's a board-certified plastic and reconstructive surgeon, as well as a biochemist. And he was most recently appointed as a clinical associate professor with the University of Arkansas Medical Sciences in the dermatology department. So that's really exciting, and we're excited to have him on here and thankful that he's happy to answer all these questions for us and for you guys. Then we also have Darla Smith. She is the general manager as well as an account executive for our wholesale accounts. Plus, she handles all of our estheticians accounts, and she handles our UK account. So she kind of has a lot going on. Just wanted to point out that when you see her today, she just had a 30% TCA done to her face on Monday. So you'll get to kind of see that live in action just 2 days out from the peel, and her little swelling and her peeling and the brownness that was caused by that. But anyway, so let's get with it. Let's get it on there. And Darla, if you'll share the slides, we will get started with our first question.
All right.
Oh, can ya?
Yeah, I can. Great.
All right. Awesome.
All right. So basically like she was saying, we have got some questions from some of our estheticians and trainers, and they have sent some pictures in of different clients that they're dealing with. So our first question that we had coming up is one of the ladies had a client that had hard cysts on her back of her arm near her elbow. And she said they're hard, but they do not itch and are not painful. On occasion, the client can extract a little, but they return. And she did tell me they were like little whiteheads, and like she can extract a little bit, but they keep coming back. What would you suggest, Dr. B, about what she should do for that?
Well, it's a little bit difficult. Just, what's the size of the lump and how often does material come out of that those areas? How long have they been there? Do they get red or inflamed? In other words, knowing more about what those actually are would give more information. But I don't know if new peel would help or not. Certainly wouldn't hurt to do a chemical peel if it's in that category of acne-like lesions that have plugged up follicles. I don't have enough information to answer for sure.
I think she mentioned that they were a lot of times on different estheticians have ran across where they have little whiteheads on people's foreheads where they sometimes use the kind of to open them up and get the little white hard pieces out of them.
Yeah, those are called milia, and those are very small little blockages, and this sounds was larger dimension.
Okay, Lori came back and said the cysts have been there a year. They're about the size of a pencil eraser. They never get red or inflamed.
Well, I'm not.
Still kind of hard to try to figure out.
Yeah, I'm not really sure what that might be. Is it on the back side of the arm or elbow area?
I think it's on the back side of the arm near the elbow. There are about 10 to 15 of them that she gets.
Same old rule, take some pictures, send them to me, and let's visit on the phone. I can't answer specifically. It sounds like it may be small inclusion cyst. It could have been ingrown hairs at some earlier stage. It could be a sebaceous gland or groups of sebaceous glands that are plugged up. Without having more information, I can't really answer. Next week I'll try to give an answer if somebody will send me a photograph.
Right. We'll she said that she sent a picture, so we will get that to you, and then we can come back and answer a little bit more on that, Lori, and I'll send you some information on that.
And certainly new peel wouldn't hurt, and doing Jessner's peel, to that area wouldn't hurt. I mean, we're not talking about
Do you think maybe since they're kind of do the new peel, and then could you also like to exfoliate, and could they do the new peel and steam it to maybe help open those up where they could extract that a little better? Or do you it's not really
anything, but we don't know if the contents are sebaceous material that's being formed or whether it's something else.
okay? All right, we'll look into that more, and that way we can give her a better answer. The next question we have is, what is the best way to treat facial laxity? And they're looking for in-office treatments or even at home care. What would you suggest?
Well, laxity is due to loss of the elastic fiber in skin. It's just like the elbow of a sweater gets stretched out on the outside because it's continually being pulled and stretched in different positions. With sun damage and age, we lose elastic fiber in our skin, but we can't escape gravity. So gravity pulls our facial tissue down, and that stretches skin, neck and face and chin, the whole area. One of the things a couple of things will help. As far as in-office treatments, a series of peels will help, and I would probably use TCA peels because they go a little deeper, and collagen is beneath the epidermis, so you want to stimulate increased collagen. The other thing that I would do is put that patient on Eternox, the peptide repair cream. Eternox has the ingredient of soluble keratin peptides. We did an independent study several years ago, nearly 10 years ago now, for a 12-week period of time using Eternox and new peel at the same time on facial skin, doing all the measurements you can. We saw a 40% reduction in neck skin laxity. I think that addresses the problem area that last question was. So it's not going to happen overnight, but in a 12-week period of time, that 40% reduction, that's equivalent to a facelift. Now you can do in-office treatments with laser type therapy, either with photo stimulation or sound wave stimulation at a deeper level. In other words, external treatments done in an office setting. I don't know what equipment may be available in the office we're talking about, but certainly at home or in the office, using the Eternox product is going to significantly decrease the laxity in skin.
And what we have showing is, from the study that's on the screen, and what, the study showed, the skin softness increased. And so this is a great product, and, with the Eternox and the new pills. So if anyone needs a copy of the study, we will be glad to send that also to you.
It's a pretty long study. It's about 30 pages, and it's
right. But this is kind of the condensed.
Yeah, well, I'd be happy to send the long study. I mean, it was well done. Same company did that independent study in Dallas that does things for Allergan or Obagi or L'Oreal or major companies. That's all they do for a living is extended studies. But yeah, I think the significance is certainly the decrease in skin laxity. But if we look at fine lines and wrinkles, they've decreased 43%. So that's the surface area as well as the laxity. And pigment and all the other things, skin tone increased 53%. The youthful look of skin increased 40%. just hard to beat those things with a topical treatment. But we won.
Yes, then this product is awesome. The Eternox is what I use daily. And of course, after I had this major TCA, it is very cooling to the skin too. When you're doing chemical peels, it's great to microneedle with. You just get great results with this product. So next slide. All right, so what the next question is what can you do for the deep wrinkles around the mouth?
Well, if we're talking about perioral, and that's like if a person were going to pucker your lips and whistle, those fine lines are deep lines that are in the actual upper lip more than the lower lip usually. The best treatment for that, well, there's a combination of things. One, you could use Botox, and that relaxes, but it's not a permanent resolution of that. You could use injectable fillers, and that's 6 months to a year perhaps, but that's not a permanent sort of solution. I would do 35% TCA peel applied with a Q-tip just to the wrinkle lines themselves, and then 20% TCA to the entire perioral lip area. That usually gives excellent resolution, and it's a permanent resolution. Obviously, quit smoking. They're called smoker lines for a reason.
Do they also, is it a wise tale that you wrinkle more on the side that you sleep on, that you should sleep on your back to keep from having wrinkles around your mouth, or is that just a wise tale?
I'm not sure about that. I mean, it'd be hard to do a study. There are some studies that have shown sunlight in the study I'm thinking of was done with truckers. Now, truckers drive all day long from east to west, and sunlight coming in the driver's door, the left side of their face would show 40% more wrinkles than the right side of their face over a 10-year, 15-year period of driving a truck. That's probably more realistic than how you sleep, because most of us don't sleep in one position all night long. During the night, we'll roll over to the other side.
Okay. I've always been asked that question, and I was like, well, I'm not sure.
I'm always asleep, so I can't.
That's true. I mean, I wake up and I might be on one side or the other, so I can't tell. I do know that I have more brown spots from the side of the window of the car. Right. You can tell when after you've had this TCA that you are more damaged from the your window in the car. So
you don't even drive a truck.
Yeah, I'd be up higher then. All right. So next question is, can my pregnant clients get a Theraderm chemical peel? And if so, which ones? And would the protocol be any different? And of course, of how many layers, it depends on which protocol you use. So,
well, as a general rule, your OB doctor would tell his patient that she shouldn't have any kind of chemical peel. In other words, those peels that are Gessner peel or TCA peel. On the other hand, a lactic acid peel, 70% lactic acid, has no downside, has no possible chance of doing anything to harm or interfere with pregnancy in the first trimester, second, or third. Nearly all damage that occurs from substances during pregnancy, the damage would occur in the first 3 months of pregnancy. That's kind of the critical time. But with lactic acid, there's no possibility of an adverse reaction because every cell in the body has lactic acid. And lactic acid is the primary mediator for our immune system. So it's favorable rather than having any negative aspect to it.
So with being pregnant, waiting, of course, check with your doctor before you do anything, make sure you get clearance on that. But is their skin more sensitive to a pill if they're pregnant, do you think? Or,
Well, I'm not sure about the answer to that. We do know that during pregnancy, hormones are shifting, all kinds of crazy ways. I'm not sure that, how pills would affect that and whatever, but I definitely wouldn't use any pill other than lactic acid. And most ladies are content to wait until the pregnancy is over if they have significant problems with their skin.
so definitely don't use the Jesners. And they asked about the protocol and the layers. On a lactic pill, you do not layer. So there's just the one layer, and to make sure you totally neutralize it.
We have a protocol written out for a lactic pill, and we'd be glad to send it to anybody that would care to email and want a copy.
Do you think, like when and I'm not sure about this because I never had this problem, but when women get pregnant, we talk about the pregnancy mask. Does that show up right away, or does that actually show up after, or like during the pregnancy, or when does that?
It normally, if it's going to show up during the pregnancy, and it's always symmetrical, and it's called the mask of pregnancy for a reason. It shows up, but it's usually after 3 months or so, and the pigment takes a while to develop. So by the end of the pregnancy, it's probably as prominent as it's going to be, but it doesn't go away after the pregnancy because the melanocytes have been reprogrammed, just like you set your thermostat to 74 degrees from 68 degrees. It's going to stay at that temperature until you change the thermostat. And that's what chemical peels and melanin suppression agents can do.
Okay. All right. Do we have another? Okay. Another question we have, is it recommended for women to start chemical peels at an early stage of premenopause to prevent hormonal hyperpigmentation?
Well, I don't think that's a cut and dried answer. Certainly, women at any age their skin can benefit from chemical peels. For one, it kind of jump starts the metabolic state in the skin, regardless of hormone, but especially if there's a hormone slowdown of the cell turnover in the epidermis. Cell turnover time in a 13-year-old child is about 2 to 3 weeks. In other words, every 2 to 3 weeks, the epidermis is totally replaced just by cells bubbling up to the top, exfoliating, and new ones taking their place. By age 40, that's probably in that duration of time necessary to completely replace the epidermis is probably going to be 9 or 10 weeks. On a person that's in the 50 to 60-year-old period of time, those cells stay there for 13 or 14 weeks. So if you slow down that cell turnover time, they build up thicker layers of dry, dead skin, which has no melanin pigment in it, or very little pigmentation to it. So we see that dry onion look, if you will. So obviously having peels starting at a younger age on a regular basis, like once yearly or once every 6 months, have a series of lactic peels or Jesner peels if you have an oily prone skin. And that will decrease the hormonal pigmentation tendency.
Also, with women, in their premenopause state, a lot of times I've seen really good results of us doing doing a facial with them and doing the new peel and exfoliating, and then doing the fruit acid and then putting the new peel on, because a lot of people don't realize that you can do the new peel and exfoliate, but then you can also use the new peel to steam with. And then that way they can put the new peel on and use their steamer, which will help bring up the yunky stuff in their skin to do extractions, and then use our reversion cleanser. And I think that will help a lot of women in that state if they do that once a month as a like a treatment that you can offer people that helps keep down the you know, even the breakouts of, you know, acne and stuff like that. Which I know that's not going to help hyperpigmentation, but I think it will help their hormonal maybe breakouts and things like that. And could they incorporate something like that with hyperpigmentation?
Well, there's no question about that. Preventing is always superior to having to go back and repair or, you know, change the situation that's there. So starting at an early age using the TheraDerm system, which is a cleansing wash, fruit acid, OPC, and appropriate moisturizer, actually keeps skin in its youngest healthy form all along. So it really, if it doesn't eliminate, it makes it very less likely that you're going to need deep chemical peels for moderate wrinkles until you're in your late 50s or 60s. So, you know, it's just like if you wash and wax your car at least once every 2 or 3 months, the paint's going to last longer and look better when it's 10 years old.
Is there a certain age that you think that they need to start on the Enlighten for hyperpigmentation to maybe prevent?
I don't think it's something that we'd talk about preventing unless they have a predisposition or some disease process that may make that more likely, or show signs of abnormal pigment coloration.
Okay.
Certainly those treatments that have been around before we relied on arbutin and kojic acid, the 4% hydroquinone, definitely is not something you'd use on a long-term continuing basis. You could use Enlighten, but I don't think it's necessary until you're showing signs of some pigment abnormality.
Okay.
The exception would be a person, say a younger person, teenager person that has severe acne. Yes, acne is an inflammatory condition, and some of those acne patients are going to have post-inflammatory hyperpigmentation when they outgrow their acne. They're going to have some brown spots. So I wouldn't have adverse thoughts about using Enlighten as they're getting their acne under control. And that's severe grade 4 acne.
Great. All right. So here we have, is there a protocol that will lift pigment deposited from microblading?
I'm not sure that I understand that question, in that microblading normally doesn't deposit pigment. I'm not seeing that connection. It may just be in the wording of that question, but it may be that pigment is more visible after microblading because you're taking some dull cell layers off of the top. So
it looks like on her cheeks that she's a lot whiter than like underneath the eyes, and I'm wondering if, and kind of looks like underneath her nose she's darker. Let me see what used to microblade. So I think that's what they're
you know, normally we wouldn't microblade the lower eyelid from the lashes down where that darkness is occurring. So I would suspect that the microblading changes would be most evident in the cheek, and that's lighter pigment rather than hyperpigment.
Okay, so this is making more sense. She is asking if there is a protocol that will lift the pigment deposited on, she used ink to microblade her on her eyebrows. So is there a protocol or something that we could use to take the pigmentation that she put in her eyebrows? I think that's what she self-treated her brows with a 50% TCA 4 days prior to this, but I don't think she got the results. And so I think she's trying to get the pigmentation, the darkness off of her eyebrows. Do you?
Yeah, well, I would ask, how far out is this photograph of the eyebrows from when the TCA was put on? It looks like there's still some redness in that under the eyebrow area.
It looks like 4 days.
So I would wait 6 weeks until all the coloration from the peel has subsided.
Okay.
Send me a picture and I'll comment on it then. But I
Okay.
suspect that there's not going to be a problem in the eyebrow area as this heals. But if you were to try to do something to it now, it's like trying to change your biscuit dough after you've already rolled it out.
Okay. So kind of let it heal up for what she did, and then
Let it get back to square one.
okay. Then let's look at it again, and then we can go from there. Okay. This is what is the best peel protocol to treat PIH in the higher Fitzpatrick?
Well, as we know, those darker 5, 6, and 7 Fitzpatrick categories are darker pigmented skin normally, and they're going to be more prone to hyperpigmentation with the deeper peels. And certainly Gessner peel, 3 or 4 layers, is going to stimulate more pigment. And TCA peels of any type are going to stimulate more pigment. I would do lactic acid peels. I'd do a series of 6, and I'd wait maybe 6 weeks and do another series of 6. All the while, during the peel healing stages and in between, every day through, a 3 to 6 month period of time, I would use a pigment suppression element like our Enlighten product on a daily basis.
And not just use on the spots, do the whole face with the
entire surface. And that's a good question. We see hyperpigmentation visibly, but there's pigment being produced all across the skin. It's just every 35 cells in the basal cell area is a melanosome. Some of those cells start producing more pigment, so you get a spot in that area where one cell is. And what we want to do is stabilize the production of melanin in all the melanocytes to a lower baseline level. So you have to treat the non-visible hyperpigmented areas. So do the entire. It's a lot easier to do the entire surface than it is to pick out 15 little spots and put a Q-tip. But you want to suppress the whole thing.
Right. And always use the sunscreen.
Always.
Always.
Except at night, use it in the
Well, yeah, not when you sleep, but a lot of times people, I always stress if you're going to be using the Enlighten Skin Brightener, I mean, you need to use sunscreen all the time, but especially when you start using Enlighten, I want to make sure people understand that it's real important to use sunscreen. Okay, this client is in her early 20s. She was treated by a dermatologist with a long-term antibiotics and birth control without resolution. She's been advised that Accutane is only remaining option, but the office that she goes to does not perform chemical pills. Would you recommend a pill protocol for this reoccurring resistant acne?
Yeah, I would. And that office is kind of misleading in that they advise, I guess it's them that advised her that Accutane was the only remaining option. She hadn't used all the options available, and the FDA mandates that you can't use Accutane until everything's been tried. And a series of Gessner peels would be certainly useful here. In the photograph that was on the left there, the severe pustular acne, Gessner's will unroof those. I may even want to go with a 10 or 15% TCA peel in 1 or 2 layers. But Gessner peel is kind of the standby to unroof those pustules. Most people don't realize that pustule stays active, red with pus underneath a capsule for as long as 6 weeks, there's going to be a permanent scar develop. If you unroof that and let it heal from the bottom, there's much less likelihood of permanent acne scars. Of course, we can treat acne scars at a later level, later age and station in life, but that's another peel, and it has to do with true dermabrasion or true deeper peels around the rim of the crater, and you know, some other things that go into it. Prevention is best. This young man, is everybody seeing the screen that I'm seeing?
Yes.
Yes.
Yeah, the young man at the top had a severe grade 4 acne, much like that young woman in the previous slide. And we treated him with the reversion system and some lactic acid peels. This is a 25-year ago picture, so we didn't have our full complement of products that we have now. I would probably add to the reversion system use, doing a series of Jessner peels first and see how he does on the reversion system in the subsequent time. Same treatment for the young lady in the middle there. She got an excellent result using benzoyl peroxide and the salicylic acid products in the reversion system, and again in the young woman in the lower picture. So we did a study, and these are patients that were in that study that were high school students that all had some degree of acne, and the school nurse had asked us if we had anything, and I said, yeah, we'd be glad to provide all the products and do pills and whatever for any of those folks that you have in the high school that are suffering psychologically, self-image, that sort of thing from, you know, high schoolers with a zit is, that's the worst thing in the world that can happen, other than your sweetheart telling you that you're not in love anymore. But we did 33 patients using original Jessner's formula for their peels at the beginning of the study and then at 4 weeks. And all of them had, on a scale of 1 to 10, all of them had between an 8 and a 10 self-reported improvement in their skin.
So if a person, I mean, most kids, you know, with Jessner's, they're going to peel quite a bit. And a lot of girls, you know, even boys, they don't like to, you know, have a lot of peeling. Do you think starting out kind of lightly and maybe doing like the protocol with the new peel and the steaming and doing the extractions and just kind of cleansing their face with the reversion to kind of get their system ready for that, and then see how that clears up some of the bacteria? Or if they're really bad, do you think just go ahead and start in on chemical peels?
I would say if you look at acne, if a grading scale of 1 through 4, 4 being the most severe and 1 being a monthly breakout or occasional breakout, those in group 1 and 2, I probably would consider treating like you're talking about with new peel and steam, extract, those sort of things. The 3s and 4s, I'd go ahead and start with Jessner's. I would add the new peel back, you know, after the healing from the Jessner's. I'd start them using the new peel on a daily basis, probably along with the reversion system products.
And just, you know, with the reversion, you know, just wanted to clarify, if they've been on our reversion and you start chemical peels or any kind of acne products, how they need to be off of it so many days before they start a Jessner's. So like on reversion, do you say at least 2 days before you do a chemical peel?
Well, if they've been on reversion, I'd like for them to be off for a week. But that's not,
Okay.
it's not nearly like if they've been on Retin-A or one of those really significant problem causing, I call it. You know, the Jessner peel has salicylic acid in it, so just because they've been using a 2% in a reversion system, along with the lactic acid, that's not going to add anything. I don't know what the benzoyl peroxide 7.5%, if they've been doing spot treatments. I'd like for them to be off of that for a week.
Okay. I think that is about all the questions that I have. Next week, and of course, you guys know that you can follow us on Facebook. We have Instagram, Twitter, YouTube. If anybody is needing, I had a couple of people send me a message that they would like, you know, our peel protocols, or, you know, anything that we can help them with. Send us questions, send us pictures. If you have where you don't want Dr. B to give an opinion, send him a picture and what they've been doing. He needs to know what products they've been on, so he, you know, he can give a, you know, a clearer picture of what's happening. And next week we are going to be talking about growth factors and why we don't use them in our products. But going forward, if you have any kind of topics that you would like us to discuss or have us do a Zoom over, please send us information. We'd be glad to hear from you. I think that's all I have.
That's all I have.
All right. Well, we'll see you guys next week. Thank you.